Latvia has one of the highest COVID-19 case rates in the world. Its beleaguered hospitals are having to ship in medical aid from other EU members. The Baltic country had nearly 1,300 coronavirus cases per million people every day in the past week. In August, that number was just 30. Latvians are now living in a strict lockdown that experts say came too late. How can the country find a way through its tough fourth wave? Welcome to your COVID-19 special. I'm Chris Colbert in Berlin. Coronavirus cases are spreading rapidly throughout Europe's Baltic states. In Latvia and Estonia, new infections this week reached their highest level since the start of the pandemic. Both countries have reimposed strict regulations. DW's Terry Schulz.
The Latvian government hopes this 4-week lockdown will give it time to curb the record-breaking climb in infections and to convince more of the population to get at least their first shot.
If we do not have a spike in the demand of vaccination during this lockdown period, then it's going to be bad.
Epidemiologist Nikita Troyanskis is the country's vaccination coordinator. He warned authorities months ago they weren't doing enough to prevent this wave. It will be a few days before it's known whether the lockdown is enough. But that's too late to save hospitals and healthcare workers from being overwhelmed now.
Every morning starts with trembling hands looking at the numbers.
This entire hospital has been transformed into a massive COVID ward. What would normally be the urology department, for example, is now awaiting patients with intensive breathing problems. This area used to be a scenic entrance hall. Literally overnight, it was transformed into the latest overflow intensive care unit, which communications director Janita Weinberga says is likely to be full within days.
It is an enormous struggle to arrange all the plans, which units need more nurses, from which units we can borrow those nurses.
But besides the virus, something else is spreading in Latvia. Blame for how it got to this point, from almost zero infections 3 months ago. Many people tell me the Latvian government botched its outreach on vaccines, particularly to the Russian-speaking minority, which was more hesitant to get the shot. Too little accurate information, too much disinformation, says parliamentarian Nikolais Kabanovs.
Latvian Russian population still is in the information space of Russia, because last 3 decades Latvian government made very poor communication strategy with these Slavic groups.
There was a lot of wrongful information, actually lies, in social networks.
Due to this, Dr. Ilse Kreutzberger says some patients who had always trusted her with their lives questioned her recommendation to get vaccinated. Adding to society's confusion, some doctors openly disagree with the government policy.
I don't think we should push anything in medicine.
But Nikita Troyanskis says the only way Latvians will get out of this crisis is to increase immunizations.
For those who have been skeptical before to change their mind, and for those who have been shy to decide now.
And now the government is adding more pressure, suggesting restrictions will be lifted in November only for those who got the shot.
Let's get more on this from Janis Klovins. He is a molecular biologist and director of the Latvian Biomedical Research and Study Center in Riga. Welcome to DW, Janis. There were almost no infections in Latvia 3 months ago. Now the country is in crisis. What is your explanation for this spike in infections?
Certainly, it's low coverage of vaccination, and my opinion is that we could have avoided this situation. And the first reason is that government postponed a major decision to introduce a compulsory vaccination to certain groups, to certain professions, in July and August, and only did so in the early October, and we see the increase in vaccination right now. And secondly, of course, is that all the restrictive measures that should be taken when the increase of infections started to happen were, I would say, like 2 weeks too late to not to completely stop this steep increase, but at least to minimize it. And for me, it is especially disappointing because Latvia has a broad coverage of testing and many other disease surveillance measures like sequencing of viral variants and monitoring in virus in the wastewater in many large cities. All these measures were introduced already, and unfortunately the advice given by many experts, medical experts and scientists did not always reach the ears of decision makers.
Now, we heard in the report that there are critics saying the government's vaccination drive didn't properly address or reach Latvia's Russian-speaking minority. Do you agree?
Not only, yeah, to some extent, yes, not only the Russian-speaking minority, but even more important, the elderly people. And of course, if these two groups overlap, that's even worse. So I think that situation is kind of being improved by the recent measures, and I think this is the right way to reach these people, is to contact them personally. And this is mostly done by family doctors that really try to reach these people and explain and invite each of them to the vaccination. But to many of them, that's probably is too late because they have already formed the decision. And I think I won't be mistaken by saying that that the Latvian society actually has never been so divided with regard to vaccination it is now, and this is really very easy to soil for this seed to really for the people to form the wrong decision and so on.
Janice, the government has declared a strict lockdown, forcing non-essential businesses to close and limiting people's ability to meet. How's the public reacting to these restrictions, particularly those people that have gotten the COVID shot?
Yeah, as I said, there is quite the society is really divided, but what I have a feeling that actually those people that are responsible, who has been vaccinated, they also understand the need for a lockdown and this critical time. And I haven't heard much of the complaints, but I think it would probably be fair to say also that the government and its action are not popular with either supporters or deniers of vaccination.
Do you think that this lockdown will increase people's willingness to go and get the shot?
Not particularly lockdown, but as I've already mentioned, these recent measures that were taken are really forcing people to take the vaccination, at least by declaring them mandatory for specific professions and groups or public sector. This is something that we already see that the vaccination rates have risen sharply compared to the summer months, and they even reached the rates in spring when the vaccination were became available to the general public. So I think that was the main reason. And I'm also convinced that many people changed their minds about vaccination in the face of death of many relatives and many friends they know. I think that's also an important factor. So at the moment, the vaccination rates are increasing.
Janis Lovens of the Latvian Biomedical Research and Study Center in Riga, thank you for talking to us.
Thank you. Bye.
The Czech Republic is another EU country reporting a spike in infections. The number of daily new COVID-19 cases is the highest since March, almost 10,000 in a country of around 10 million. More than 2,000 people have been hospitalized for the first time in nearly 6 months. The Czech vaccination rate is above other countries in the region, but below the European Union average. So it's been pushing vaccinations to reduce the burden on its hospitals, with now almost 40,000 people getting the shot daily. And now it's time for our science correspondent, Derek Williams, with one of your questions.
What are health authorities now saying about vaccinating children under the age of 12?
Only a few countries, among them China and Cuba, have been vaccinating children under 12 so far. But a lot of countries have approved vaccines for all kids over 12, although uptake in many places has been slow. That's because even parents who wouldn't think twice about getting vaccinated themselves remain cautious when it comes to their children. Here in Germany, for example, fewer than half of all 12 to 17-year-olds are currently fully vaccinated, although the country's vaccine commission approved shots for that age group back in August. And the younger the child, the more wary parents are likely to be when it comes to trying to figure out the potential costs and the potential benefits of vaccination, regardless of what health authorities say is the right way forward. Expect things to go pretty slow, therefore, now that the Pfizer-BioNTech messenger RNA vaccine has been authorized in the US by the FDA and the CDC for emergency use in children between the ages of 5 and 11. That decision was based on studies showing that even when given at a lower dose than in adults, the vaccine was over 90% effective at preventing COVID-19 in 5 to 11-year-olds, while no serious side effects were detected. It's thought that generally mild cases of myocarditis, so an inflammation of the heart, one very rare side effect we know from older groups, will also occur in younger children as well when very large numbers of vaccinations are given in the group. But since that condition can also be caused by COVID, models predict that potential benefits significantly outweigh any potential risks. The European Medicines Agency is also now evaluating the trial data and is expected to come to its own conclusions by the end of the year.
Well, health authorities here in Germany are still debating whether and when to give people booster shots. But the panel of experts making that decision says one thing is clear. Thomas Mertens, the head of the panel, says they are recommending a booster for people who had the Johnson & Johnson vaccine, which comes as a single dose. Research shows its protection starts to fade after a couple of months. Other countries, including Spain and the United States, have already started offering boosters for Johnson & Johnson recipients. That's our show. Thanks for watching.